Hi, everyone. Thanks for joining us today on the first day of our virtual conference, Resilience and Disaster, the Global South During COVID-19, hosted by Relocation's Journal of Asia and the Pacific World. We're your co-chairs, and we're very excited to welcome you to today's panel.
Hi everyone, my name is Laura and I'm currently completing a Master of Education in Curriculum and Pedagogy with a specialization in digital technologies at the University of Toronto. My research is broadly interested in higher education futures, the visuality of online learning environments, and multidisciplinary pedagogy. I currently serve as a co-manager of relocations, and Shanur and I are very much looking forward to listening to your presentations.
Hi, my name is Shahnur, and I'm a doctoral candidate at the Department of Political Science at York University. My research broadly examines terrorism, political economy, and political ecology. I'm currently a senior editor at Relocations as well as the director of communications. I'm very excited to be co-chairing with Laura and to learn from our wonderful speakers about the impact of COVID-19 on the Global South and the diaspora.
Our journal is affiliated with the Dr. David Chu program in Asia Pacific Studies at the University of Toronto. Relocation seeks to foster dialogue among scholars, researchers, and graduate students who engage in ideas such as territoriality, mobility, and identity within and across borders. We invite critical engagement and promote debates in international relations, art and culture, geography, political science, and a wide range of other related fields, and aim to dismantle the boundaries of academia. Since we're an open access journal, we believe it's important to foreground the stories, energies, and knowledges of emerging academics, Black, Indigenous, people of color, and Global South scholars. As academia becomes increasingly neoliberalized and the voices and contributions of disenfranchised groups continue to be marginalized, we hope to present the voices and visions of our speakers with the sincerity and care that they deserve.
Laura and I were inspired to organize this conference after reading an article by Dr. Jonathan Corpus-Ong and Dr. Gideon Lasco published with LSE on the consequences of the Western media's framing of the Global South during COVID-19. In the article, they write, "As social scientists, we fear that such dangerous narratives are encouraging racism and hate by portraying vulnerable populations as virulent carriers rather than victims worthy of empathy and sympathy. This applies, of course, to Western global media coverage of an exotic disease arising from dirty and distant lands. But crucially, we want to point out how this othering of mainland Chinese people is also painfully felt within and among Asian countries, as social tensions in the region have escalated in response to China's political and economic aggressions." We've been very lucky to have both Dr. Corpus-Ong and Dr. Lasco join us in this symposium as keynote speakers.
COVID-19 is a public health crisis occurring on a global scale. It has caused widespread suffering and disruption, and in the process, it has exacerbated existing inequalities, strengthened networks of solidarity, birthed new crises, devastated economies, altered politics at local, national, and international levels, and more. In these ways, the virus is a disaster that has given rise to complex and uncertain transformations, but it has also led to a great display of resiliency, with different states, communities, and individuals adapting to and resisting this disaster. The global spread has laid bare the need for critical engagement with cross-disciplinary, cross-national, and cross-cultural dialogues. Our symposium explores the far-reaching and extensive effects of the pandemic in the Global South. Media coverage of the pandemic is playing an important role in COVID-19 response. The dominant mainstream coverage of the Global South and the West has been marred with misinformation, stigma, racism, sensationalism, and the rhetoric of blame and shame. For example, early in the coronavirus outbreak, before the scientific name of the virus entered the global lexicon, many media outlets referred to it as the Wuhan virus. This wording tended towards stigmatizing people from that region, having the unintended consequence of stoking xenophobia and anti-Asian fear and violence. We want to create a space that challenges these narratives and presents critical and progressive scholarship on the impact of COVID-19 in the Global South. Through their presentations, our speakers will engage with themes such as global politics, labor and work, access to services, communities and connections, and equity, justice, and activism.
Canada has now surpassed 10,000 COVID-19 related deaths. Globally, the death toll has exceeded approximately 1.2 million. Each statistic represents a person with their own story. This symposium has been organized in loving memory of all of the lives lost to COVID-19. It's a humble attempt by a global community of academics, researchers, and graduate students to better understand the consequences of this deadly virus with regard to race, class, gender, religion, sexual orientation, geographic location, and more. The ultimate aim is that these discussions will engender deeper compassion and transnational solidarity, and that this knowledge production will lead to policies that prioritize the safety and well-being of all people.
The conference will take place over the course of 3 days. Each panel will be preceded by a keynote address. Day 1 of the symposium, led by a keynote address by Dr. Tungawin, will examine migration, care work, and solidarity across the global south and diaspora from Lebanon to Bangladesh to Asian international students in Canada. At 4:15, the presentation will look at mediating contagion, Asian international students in Canada during COVID. At 4:30, we'll move on to a presentation on fatalistic views and its impact on combating COVID-19 in a Bangladesh context. At 4:55, we have a presentation titled The Beirut Explosion and COVID-19, Crisis Relief and Community Reactions During Lebanon's Collapse Intermission. We'll end the panel with a presentation titled Displaced and in the Dark, Protecting LGBTQI+ Asylum Seekers During a Pandemic. From 5:45 to 6 o'clock p.m., we'll end our day with a live Q&A session.
Dr. Ethel Tungawin is an associate professor at the Department of Political Science at York University. She's also a Canada Research Chair in Migration Policy, Impacts, and Activism. Her keynote address is titled COVID-19, Immigration, and Care Work, Thinking Through the Implications of COVID-19 on the Lives of Asian Immigrants. Dr. Tungawin's abstract reads as follows. Despite calls that we are all in this together, the impacts of COVID-19 have been felt disproportionately by racialized and working class communities, most of whom are a part of essential workforces that ensure that society continues to function during the pandemic. In fact, in Canada, the majority of essential work is performed by racialized migrant workers from the global south. Migrant care workers in particular are placed in a no-win situation. Not only are they expected to continue working under labor conditions that have been made more intense because of the pandemic, they are additionally required to meet ever-changing immigration and labor criteria to justify their continued stay in the country. Her presentation draws attention to how conflicting discourses of security place racialized migrant workers in the global south in an untenable solution of having to navigate being seen, on the one hand, as providing essential labor, but also, on the other hand, as being seen as threatening the physical and economic security of the nation.
Day 2 of the symposium, led by a keynote address by Dr. Corpus Ong, will examine media, security, and communications in India, the Philippines, Sri Lanka, and more. At 4:15, we'll begin with a panel titled Securitizing COVID-19 in the Philippines, Outcomes and Risks. At 4:40, we'll move on to a presentation titled Corona Nationalist Solidarity Amidst the COVID-19 Pandemic in India. The next presentation, at 4:55, will look at the racial and olfactory origin of social distancing. To conclude the panel at 5:10 is a presentation titled COVID-19, Disaster Prevention Mechanism Undertaken by Sri Lanka, SWOT Analysis. We'll finish the day with a live Q&A session from 5:25 to 5:40 p.m.
Dr. Jonathan Corpus Ong is an associate professor at the University of Massachusetts Amherst and a research fellow at Harvard University's Shorenstein Center. His keynote address is titled Mitigating the Contagion of Stigmatization, Racism and Discrimination in the Infodemic Moment. His talk discusses the secondary contagion of racism and other forms of social stigmatization unleashed by the coronavirus outbreak in the global context. He begins with a critique of how cultural biases in journalistic reporting have contributed to the stigmatization and shaming of marginalized communities. He then identifies the intentional media manipulation practiced by politicians and authoritarian governments targeting vulnerable groups, opportunistically using fears of the virus and fears of fake news to seize political control. He ends with a reflection on how scholars conducting risky research can better support each other, manage the mental health impacts of research on COVID-19, and develop new tools of solidarity and allyship.
Day 3 of the symposium, led by a keynote address by Dr. Lasko, will consider public health in the Global South, examining medical populism, necropolitics, and resiliency. We'll begin the panel presentations at 11:15 with migration and social isolation during the global pandemic, uncertainty, advocacy, and resiliency. At 11:30, we'll move on to India during pandemic, the curious case of witch hunting and vilification of democratic protests. At 11:45, we'll continue to a presentation titled COVID-19, Necropolitics, and Marginalized Experiences During a Global Pandemic. We'll conclude with a presentation at 12 p.m. titled Corona Effect on South Asian Politics, Diminishing Geopolitics and the Inception of Geoeconomics. From 12:15 to 12:30, we'll end our symposium with a live Q&A session.
Dr. Lasko is a physician and medical anthropologist. He's a senior lecturer at the University of Philippines Stillman's Department of Anthropology and a research fellow at Ateneo de Manila's University's Development Studies Program. As the COVID-19 pandemic has been made painfully clear, his talk discusses the politics of epidemics and other health crises, which have had profound consequences for people around the world. Using illustrative examples from Asia and the Pacific, his presentation discusses the framework of medical populism to describe the ways in which health crises are politicized, and reflects on the particularities of the Global South that make it vulnerable to this kind of leadership style.
Teachable is typically employed as an online course platform, so moving through the symposium is very similar to moving through an online course. As seen in the example here, the keynote addresses and conference schedule are in separate content areas. If you click on the icon titled Resilience and Disaster, the Global South during COVID-19, you'll find the full conference program. To view each keynote address, you'll have to click the picture of the keynote speaker. Whether presentations are live or pre-recorded, they'll be embedded into Teachable for your viewing. To view the panel presentations is a similar process. You'll go to the icon titled either Day 1, Day 2, or Day 3, and the individual presentations will be listed as course curriculum. To view a presentation, you would simply click on the presentation title and be able to view whether it's live or pre-recorded. We encourage participants to use the comment function located at the bottom of each module. Viewers and presenters can leave comments for each individual presentation. The questions will then be collected by the moderators and presented during the Q&A sessions at the end of each day.
Thanks for joining us, and we look forward to seeing you throughout the next 2 weeks. We're excited to begin and hand over the mic to our first speaker, Dr. Tungwin. Please continue scrolling to the next video.